Search and video. Did you know that up to 8 out of 10 diabetics over the age of 50 have a silent deficiency in a single vitamin that's absolutely critical for insulin to work properly? Yes, that same insulin that, when it's not functioning correctly, allows glucose levels to spike even when you're eating right. Sometimes it feels like we're doing everything possible, doesn't it? We watch our diet carefully, follow all the guidelines, but blood sugar continues to misbehave. I'm Dr. Michael Kent, a family physician who has spent over 15 years helping my patients manage their diabetes by finding solutions that don't just add to their list of medications, but optimize what they're already doing. And believe me, I've encountered every scenario imaginable. Today, my mission is to reveal to you, backed by scientific research and my clinical experience, which 3 vitamins have a genuine impact on reducing blood sugar levels, and more importantly, how to take them safely and effectively. If you can stay with me until the end of this video, you'll walk away with a detailed 4-week protocol that's already transforming the lives of thousands of my patients. So take a deep breath, relax for a moment. What you're about to learn today could save you not just those frustrating blood sugar spikes and crashes that drain your energy, but also, and this is invaluable, some potentially serious medical complications. Are you ready to revolutionize your glucose control? Let's dive in. Why does control fail when I'm doing everything right? This is a story I hear almost daily in my practice. Doctor, I just don't understand. I'm doing everything they tell me to do. I follow my diet to the letter. I take my insulin injections or pills religiously, but my A1C remains stuck at 8.5% or even climbs higher. It's frustrating, I know. And naturally, the first thing that comes to mind is diet. Am I eating something wrong? Then there's stress, which we know disrupts everything. And of course, weight is always part of the conversation. But let me tell you that very often there's a fourth factor, one that's nearly invisible, a true silent saboteur, the deficiency of essential micronutrients. Imagine this: insulin, whether it's produced by your pancreas or administered through injection, functions like a key. Its purpose is to unlock your cell doors so that glucose, your fuel, can enter and be used as energy. Now, that door has a lock, which are your insulin receptors. And here's where it gets interesting. For that key to turn smoothly in the lock, we need lubrication. That lubrication consists of certain vitamins and minerals. If that lubrication is missing, if there's a deficiency of these key micronutrients, the key simply cannot turn properly. The cell door doesn't open easily. And what happens then? The glucose remains floating in your bloodstream, driving your levels up. Just repeating this process month after month, year after year, is tremendously taxing on your pancreas, which exhausts itself, producing more insulin uselessly. It worsens insulin resistance, meaning you need increasingly more medication, and it accelerates the path towards serious diabetes complications. It's a vicious cycle that we must break. The lab reports I receive from external laboratories from patients who come to my practice seeking answers show a clear pattern. Time and again, diabetics, especially older adults, present significantly lower levels of vitamin D, vitamin E, and magnesium compared to the general population. Why does this happen? The reasons are multiple and interconnected. First, when blood glucose is chronically elevated, our kidneys work overtime, and in doing so, they eliminate more minerals and vitamins through urine. It's as if the body, in its attempt to get rid of excess sugar, also flushes out valuable nutrients. Second, and this is crucial, some diabetes medications like metformin, although wonderful and necessary, have a known side effect. They reduce the absorption of certain vitamins like B12 and, to a lesser extent, vitamin D. Third, as the years pass, our intestines age, and like many other parts of our body, they're no longer as efficient at extracting all the nutrients from the foods we consume. Add to this that many people avoid the sun, our primary source of vitamin D, due to fear of sunburn or medical advice, and that red meat, an excellent source of vitamin E, is often restricted in healthy diets due to cholesterol concerns. The result is a cocktail of hidden deficiencies that, without our knowledge, are sabotaging even the best therapeutic plan for diabetes. The good news, the wonderful news, is that correcting these deficits doesn't require expensive pharmaceuticals or complicated shock protocols that turn your life upside down. With doses adjusted to your needs, without dangerous interactions with your current medication, and always under medical supervision, we can see astonishing results. In fact, it's common to observe a decrease in fasting glucose of between 15 and 25 milligrams per deciliter within just a few weeks. Imagine that impact. Vitamin 1, vitamin D3, the master key. Let's start with the star. What I consider the master key, vitamin D3. Vitamin D3, my friends, isn't just the bone vitamin. Although it's certainly fundamental for them, it's so much more than that. I call it the hormone vitamin because it acts as a true conductor in our body, turning on and off more than 1,000 genes. And among them, guess which ones? Yes, the ones that manufacture glucose transporters, those that help sugar enter your cells. It's a fundamental pillar in cellular communication. What does the science say? Well, a meta analysis published in 2023 that combined results from 46 robust clinical trials demonstrated conclusively that supplementing with daily doses of 1,000 to 4,000 international units of vitamin D3 can reduce A1C by an average of 0.32 points and fasting glucose by about 10 milligrams per deciliter. Those aren't minor numbers, they're changes that make a real difference in your health. In my own clinical experience, I've observed that older adults who manage to maintain their 25 hydroxy vitamin D levels between 30 and 50 nanograms per milliliter not only need fewer units of insulin, but also experience far fewer glucose spikes after eating. Their control is simply more stable and predictable. Now, the million-dollar question, how do you know if you're lacking this crucial vitamin? Often the deficiency manifests with silent signs that we usually attribute to age or fatigue. One very common sign is muscular fatigue. That feeling that it's hard to get up from a chair as if your muscles don't have the strength they used to. Nighttime calf cramps can also appear, or those annoying involuntary contractions in your fingers or toes. But the most reliable method, of course, is a blood test. Ask your doctor for a 25 hydroxy vitamin D analysis. If the result is below 20 nanograms per milliliter, we're talking about a severe deficit. If it's between 20 and 29 nanograms per milliliter, you have insufficiency. With that data in hand, we can calculate the precise dose for you. Generally, 2,000 international units per day for a couple of months is enough to replenish levels, then maintain them with 1,000 international units daily. An important detail. If you have obesity, your vitamin D3 requirement can be almost double. Why? Because vitamin D is fat soluble. It hides in body fat and isn't as available in the bloodstream to perform its functions. Where do we get vitamin D? Fatty fish like salmon, sardines and mackerel, egg yolks, and shiitake mushrooms exposed to sunlight are sources, but let's be realistic. To reach those 2,000 international units daily, you'd have to eat something like 200 grams of salmon every single day. Impractical and unfeasible for most people. That's why supplementation in capsules is usually the most reliable and consistent option. I recommend looking for vitamin D3 dissolved in olive oil or another oil, not in powder form. The reason, it absorbs up to 30% better. And a trick, always take it with a meal that contains some fat. If your breakfast is fat-free, then switch it to lunch to maximize absorption. A word of caution because safety comes first. If you have any kidney disease, or if you take thyroid diuretics, it's essential that you inform your doctor before starting supplementation. Vitamin D increases calcium absorption, and in cases of kidney damage, this could raise blood calcium levels to dangerous heights. The safe limit for most people is 4,000 international units per day. And please don't be tempted by mega vitamin doses of 10,000 international units or more without very close medical supervision. More isn't always better. And in this case, uncontrolled excess vitamin D could paradoxically calcify blood vessels and soft tissues, which is the last thing we want. After about 8 weeks of supplementation, I encourage you to repeat the 25 hydroxy vitamin D test. If you're already in the optimal range, I assure you that you'll start noticing a significant difference. Less postprandial drowsiness, that heaviness after eating, a notable improvement in your mood because vitamin D also regulates serotonin, the happiness hormone, and what interests us most here, much more stable blood sugar. Vitamin 2, natural mixed vitamin E, the cellular shield. Now that the master key is functioning at full capacity, it's time to reinforce the lock with a powerful antioxidant, vitamin E. Vitamin E is a true treasure, but you have to know how to choose it wisely. It's not a single molecule. Single. It's an entire family. It consists of 8 distinct molecules. 4 tocopherols, alpha, beta, gamma, delta, and 4 2-trienols. The problem I see with many cheap supplements on the market is that they only contain synthetic alpha tocopherol. And this is a mistake because taking only one of these forms can displace the others, drastically reducing the efficacy and broad spectrum of benefits that natural vitamin E offers. Recent studies in diabetics, including one from 2022, have demonstrated that a dose of 200 milliliters per day of natural mixed vitamin E, meaning with all its forms, can reduce fasting glucose by 8 to 12 milligrams per deciliter. And what's even more important, it decreases oxidative stress markers like melandehyde by up to 25%. That's a significant reduction. And you might wonder, why should we care so much about oxidative stress? Think about this. Every extra glucose molecule circulating in your blood is like a sticky candy. The longer it lingers there, the more it caramelizes or glycates your proteins and blood vessels, damaging them. Free radicals are responsible for this oxidative damage. And what they do is block the insulin signal, making it even harder for sugar to enter cells. Vitamin E, in its natural and mixed form, acts as a protective shield, neutralizing those free radicals and preventing them from breaking the essential communication between insulin and its receptors. It's like putting up a barrier to protect the integrity of your cells. How can you suspect you're lacking vitamin E? There are signs, though subtle. Dry, flaky skin that doesn't improve with moisturizers. Slow healing of minor wounds. Ones that used to heal quickly now take forever. Calf cramps when walking short distances. And curiously, a loss of brightness or nighttime visual acuity. Another indicator, if you have access to your complete blood count reports, is if deformed red blood cells known as ovulocytes appear. If you see any of these signs, it could be a clue. Regarding dose and form, my recommendation is to look for a supplement of 200 milliliters per day of mixed vitamin E containing alpha, beta, gamma, and delta tocopherols. If the supplement also includes 2-trienols, 100 milliliters is usually sufficient. Like vitamin D, always take it with food because absorption improves by up to 70% in the presence of fats. And here's an important warning. Avoid capsules promising 400 milliliters or more of vitamin E, especially if it's only alpha tocopher. High doses, particularly of synthetic forms, have been associated with an increased risk of hemorrhagic stroke and can antagonize vitamin K, which is crucial for blood clotting. Speaking of interactions, if you take anticoagulant medications like Wararin or antiplatelet agents, it's absolutely vital that you notify your cardiologist before starting vitamin E. It can prolong bleeding time. It can also have a slight effect on blood pressure, lowering it. This can be useful if you have hypertension, but if not, watch for possible dizziness. What foods are rich in vitamin E? Almonds provide about 7 milliliters per 30 gram, hazelnuts, unrefined sunflower oil, avocado with about 4 milligrams per half, and dark leafy green vegetables. If you include about 30 grams of unsalted nuts in your daily diet, you're already covering almost half of the recommended dose. However, to ensure consistency and optimal dosing, supplementation is usually more effective. In my practice, I often combine vitamin E with vitamin C because both recycle each other mutually, enhancing their antioxidant effects. But careful, a crucial precaution, vitamin E improves glucose uptake by cells. If you take insulin or oral hypoglycemic agents, this means the same dose of your medication could lower your blood sugar more. You must be very alert to possible hypoglycemia. If you notice it, consult your doctor immediately so they can adjust your hypoglycemic medication doses. Never, under any circumstances, do this on your own. With vitamin D3 and natural mixed vitamin E, you already have an elite army protecting your cell membranes and improving insulin sensitivity. But we're missing a key component, the electrical regulator that allows muscle, that great glucose consumer, to actually use it. I'm referring to magnesium, vitamin 3, elemental magnesium, the electrical regulator. Magnesium, although sometimes forgotten, is the fourth most abundant mineral in our body. And believe me, it's an authentic marvel. It participates in more than 300 vital biochemical reactions. One of the most important for diabetes control is its role in phosphorylating the insulin receptor. What does this mean? Without magnesium, even though insulin reaches the cell, that key we talked about earlier, the door simply doesn't open correctly. It's as if the mechanism is jammed. It's no coincidence that a very revealing prospective study from 2021, which followed more than 42,000 older adults, demonstrated that those who ingested less than 200 milligrams of magnesium per day had a 37% higher risk of developing type 2 diabetes. And in those who are already diabetic, the relationship is inverse and clear. For every zero point 0.1 mil per liter that serum magnesium rises in the blood, A1C drops 0.23 points. This isn't a coincidence, it's a direct and powerful connection. How do you know if you're lacking magnesium? The symptoms of deficiency are varied and often nonspecific, which makes diagnosis difficult. Nighttime cramps, especially in the legs, are a classic. Palpitations after eating, chronic constipation, jaw contractions when chewing as if your joint hurts, and that classic involuntary blinking or tremor in the eyelid when you're at rest. But magnesium doesn't just affect muscles. It also plays a crucial role in your emotional well-being. It manifests as anxiety, irritability, or difficulty relaxing because this mineral is a key regulator of the hypothalamic pituitary adrenal axis, our stress response system. When we talk about magnesium supplements, the variety can be overwhelming, but I'll give you some pointers. Magnesium oxide is very common and cheap, but its absorption is low and tends to be laxative. Magnesium citrate, on the other hand, absorbs quite well and is an excellent option if you also suffer from constipation. If you're looking for something gentler on the digestive system with high bioavailability, magnesium bisglycinate is a gem. It's neutral at the intestinal level and minimizes the risk of diarrhea. And if you're someone who hates capsules, magnesium chloride dissolves easily in water and can be a practical alternative. The usual dose is 200 to 400 milligrams of elemental magnesium per day. And my advice is to split it into two doses to reduce any possible laxative effect. Start with 200 milligrams the first week. And if your bowel movements tolerate it well, you can gradually increase. What about food sources? They're delicious and easy to incorporate. Chia seeds, pure unsweetened cocoa with about 20 milligrams per tablespoon, cooked spinach, almonds, chickpeas, and mineral water rich in magnesium are excellent options. Some water brands can provide up to 110 milligrams per liter. If you prepare a smoothie with 200 ml of mineral-rich water, a tablespoon of pure cocoa, and a tablespoon of almond butter, you're already getting almost 150 milliliters of magnesium without needing supplements. A good start. Important interactions. Proton pump inhibitors, those medications used for stomach acidity like omeprazole or pantosol, reduce magnesium absorption by up to 60%. If you've been taking a gastric protector for more than a year, it's almost certain you need to supplement magnesium. Thyroid and loop diuretics used for hypertension or fluid retention also increase magnesium elimination through urine. If you take any of these, talk to your doctor about adjusting the dose. A serious precaution. If your glomerular filtration rate is below 30 milliliters per minute, meaning if your kidneys aren't functioning entirely well, your doctor should adjust the dose to no more than 100 milligrams per day and monitor your serum magnesium levels. Excess magnesium, though rare with healthy kidneys, can cause diarrhea, muscle weakness, and, in extreme cases, cardiac arrest. But don't be alarmed. With healthy kidneys, it's very difficult to reach toxicity through oral intake. When you manage to optimize your magnesium levels, we're looking for serum magnesium of 0.85 to 1 ml per liter. You'll notice a big difference. Fewer cramps, more restorative sleep, regular bowel movements, and what brings us here? Much smoother blood sugar spikes after meals. Many of my patients tell me they can reduce between 2 and 4 units of rapid insulin without their glucose spiking. This translates to fewer hypoglycemic episodes, more peace of mind, and a much better quality of life. 4-week mini protocol. Now that you know the power of D3, E, and magnesium, I propose a simple 4-week plan to start feeling the benefits. Remember, always with your doctor's supervision. Week 1, start with vitamin D3. Take 2,000 international units with lunch. Remember, alongside some fat for better absorption. If in your last blood test your 25-hydroxy vitamin D was below 20 nanogs per milliliter, severe deficit, you can go directly to 4,000 international units. Now add mixed vitamin E, 200 milligrams, this time with dinner. It's important that you start recording your fasting glucose every morning and 2 hours after your largest meal. Also, note any changes in your cramps, sleep quality, and general mood. Please, in this first week, don't change your hypoglycemic medications. We want to see the effect of the supplements on their own. Week 2, it's time to incorporate magnesium. Start with 200 memograms at breakfast. If you notice any mild diarrhea, don't worry, it's common. In that case, switch to bis-glycinate form or divide the dose, 100 milligrams in the morning and 100 milligrams at night. Keep diligently recording your glucose levels. Many of my patients already start seeing a drop of 10 to 15 milligrams per deciliter in their fasting glucose at this stage. If your levels are between 70 and 110 milligrams per deciliter and you start noticing hypoglycemia below 70, it's crucial that you consult with your doctor to adjust your medication. I repeat, never do this alone. Week 3, if you've tolerated magnesium well, you can increase the dose to 300 or even 400 milligrams, always listening to your body. Review the records you've been keeping. If your blood magnesium is already above 0.85 mils per liter, you can maintain the current dose. Similarly, if your vitamin D has exceeded 30 nanogs per milliliter, you can reduce the dose to 1,000 international units daily for maintenance. Now, incorporate a daily natural source of these nutrients. It could be 30 grams of unsalted nuts or 2 small servings of fatty fish per week. Small changes that add up significantly. Week 4, the moment of truth has arrived. Repeat a complete blood panel. Request glucose, A1C 25 hydroxyvitamin D, magnesium, calcium, and if you take anticoagulants, a coagulation test. With these results, if your numbers have improved, evaluate with your doctor the possibility of reducing your basal insulin dose by 2 to 4 units or lowering 1 pill of your oral hypoglycemic agent. Remember, the goal isn't to stop medication abruptly, but to need the minimum amount compatible with an A1C below 7%, and most importantly, without hypoglycemia. And some extra tips because health is a whole. Maintain optimal hydration, at least 2 liters of water per day. Your kidneys work hard to eliminate glucose and minerals, and water is their ally. Light strength exercise, like using resistance bands for 10 minutes after each meal, is pure gold. It improves glucose uptake by your muscles without depleting liver glycogen. Monitor your weight. If you lose more than 2 kilograms in a month, it could be water and mineral loss, not just fat. In that case, adjust your potassium and magnesium intake with your doctor. If at the end of these 4 weeks your A1C has dropped between 0.3 and zero point 0.5 points, and you also feel more energetic, less tired, we've won an important battle. If you don't see the expected changes, don't get discouraged. We'll review. Perhaps you need a finer adjustment of carbohydrates or to address stress, improve your sleep, review whether your statins, which sometimes can raise blood sugar, are having an influence, or even look for hidden infections. The key to all of this, never change 3 things at once. That way, we'll know exactly what works for you. Frequently asked questions. I know that when talking about supplements, many doubts arise, and that's normal. I've compiled the most common questions my patients ask me to resolve them right here. Can I take them all together? Absolutely. In fact, D3 and magnesium are great allies. Magnesium is necessary to activate vitamin D, and vitamin E even improves D's stability. The ideal is to spread them throughout the day for better absorption and to avoid any digestive discomfort. For example, D3 with lunch, taking advantage of fats, magnesium divided between breakfast and dinner, and E with dinner. This way, your body takes maximum advantage of them. What if I take metformin? This is an excellent and very frequent question. Metformin, although a very effective medication, has a known side effect. It can reduce the absorption of vitamin B12 and, to a lesser extent, vitamin D3. So, if you take metformin, I strongly recommend you check your B12 levels annually. If they're low, add a supplement of 500 micrograms per day of cyanocobalamin, or better yet, 1,000 micrograms of methylcobalamin, which is a more active and bioavailable form. Additionally, magnesium will help counteract the constipation that metformin causes in some people, so it's a double benefit. Do they work for type 1 diabetes? Yes, totally. But with some important nuances. Vitamin D3, for example, has been shown to improve the function of remaining beta cells in the pancreas and reduce inflammation, which is very beneficial. Vitamin E protects blood vessels from oxidative damage, something critical in type 1 diabetes. And magnesium, by decreasing peripheral insulin resistance, is a great help since many patients with type 1 diabetes who present chronic hypoglycemia usually have a deficiency of this mineral. These supplements, of course, never replace insulin, which is vital, but they can help reduce the total doses needed and stabilize those annoying glucose variations, always under your endocrinologist's supervision. Is there a risk of hypoglycemia with these supplements? It's a valid concern. However, the supplements by themselves don't cause fasting hypoglycemia in the sense that your pancreas or your injections exceed what's necessary. What happens is that by improving insulin sensitivity, your body becomes more efficient. This means that the same dose of insulin or your oral medication can lower glucose more. That's why it's so important that you closely monitor your numbers. And if you notice that sugar drops too much, consult your doctor so they can adjust your medication. It's a sign that it's working. And vitamin C can be added, yes, about 500 milligrams per day as an extra antioxidant. However, the scientific evidence of its direct and significant impact on diabetes control is more modest compared to D3E or magnesium. It's not usually a priority unless you have a demonstrated deficiency or if you suffer from slow wound healing, where it can indeed be very helpful. When will I start seeing results? Patience is a virtue, but results are usually gratifying. In about 10 to 14 days, many patients already notice less fatigue and a reduction in cramps. In 4 to 6 weeks, it's common to see an improvement in fasting glucose, and the most significant impact on A1C is usually observed at 3 months. If after a month you don't see any change, don't get discouraged. Review doses. Make sure you're being consistent with taking them. And if all that's in order, explore with your doctor other possible causes of insulin resistance like sleep apnea syndrome, chronic stress, corticosteroid use, or even hidden infections. Can I open the capsules and mix them with something? Good question. Vitamin D3 and E capsules, which usually come in an oily base. Yes, you can open them and mix them with yogurt, a smoothie, or a little oil. Magnesium, if you buy it in powder form, sometimes has a slightly metallic taste. I suggest mixing it with water, a splash of lemon, and a little stevia to make it more pleasant. If you use magnesium chloride, which is quite salty, you can prepare 1 liter of water with about 2 grams and drink 100 milliliters at each dose. This way, you distribute the saltiness. Is there an age limit for taking these supplements? Not at all. Even patients over 80 years old respond very well to these supplements. What I do recommend is starting with half the suggested dose and increasing it progressively, always observing how you feel. If you have severe kidney failure, it's vital that your doctor adjust the magnesium dose to no more than 100 milligrams per day and monitor your potassium levels since electrolyte balance is more delicate. Do I need a prescription to buy them? No, you don't need a prescription to buy these supplements as they're classified as dietary supplements. However, my advice is to look for trusted brands that have quality seals like GMP, Good Manufacturing Practices, or USP, United States Pharmacopoeia. Avoid those products that mix 20 ingredients in a single capsule. It's very difficult to dose each component correctly, and they increase the risk of unwanted interactions. Purity and quality matter a lot. What if I do intermittent fasting? You can maintain your intermittent fasting without problem. These supplements don't break the fast if they have less than 5 kilocalories. The ideal is to take vitamin D3 and E with your first meal of the day to take advantage of the presence of fats. Magnesium, on the other hand, you can take even while fasting, although some people experience mild diarrhea if they do so without accompanying food. Listen to your body. Take action now. There you have it. Now that you know how vitamin D3, natural vitamin E, and magnesium can be your great allies in lowering your blood sugar, improving your energy, and protecting your long-term health, it's time to take action. If this video has been useful to you, please subscribe to my channel so you don't miss more tips and advice on evidence-based diabetes management. And of course, share this video in your diabetes support group with your friends or family members. Sometimes the best gift we can give is valuable information that can prevent a scare and improve the quality of life of someone we care about. Until next time, Take good care of yourself and never stop monitoring your blood.